Hi, I'm Dr. Steve Pratt from Academic Medical Associates in Irving, Texas. When new drugs come on the market, the FDA requires a prescription to ensure that doctors and pharmacies are watching for unexpected side effects and other potential problems. However, the FDA continues to monitor drugs over time and will allow some drugs to be sold over the counter if they've proven to be safe. Today we are going to talk about some of the major medications that required a prescription in the past but are now available over the counter without a prescription. Over-the-counter drugs are more convenient than prescription drugs. They can be obtained whenever and wherever you need them and don't require a doctor's appointment first. They're also usually less expensive than prescription drugs. However, over-the-counter drugs are not usually covered by insurance, and they might be sold in lower doses than the prescription version. Also, a low-cost generic prescription might be less expensive than a similar brand name over-the-counter drug. Some medications are never released over the counter, even though they've been on the market for many years. Some of the possible reasons are, obviously, some medications have serious side effects, or they may have interactions with other medications that cause serious problems. Also, some medications require laboratory testing to watch for internal side effects that a person might not notice. And then finally, some medical conditions require either diagnostic testing or the expertise of a physician to confirm the need for the medication in the first place. Of all the medications that are available over the counter that used to require a prescription, many of them fall into one of just a few categories. First is allergy medications. This includes things like non-sedating antihistamines, drugs like loratadine and cetirizine. It also includes some of the cortisone nasal sprays, like fluticasone. Quite a few heartburn medications also used to require a prescription. This is drugs like famotidine or omeprazole. And finally, there's a number of pain relievers that used to require a prescription. The biggest one that comes to mind is ibuprofen. There are two newly approved over-the-counter drugs that I would like to point out today. First is olopatadine. This is an eye drop that is used for seasonal allergies. It is not unusually strong, but many of the patients I have talked to say it is very gentle and has few side effects. Second is a drug called diclofenac. It is a pain reliever that is primarily used for arthritis. Diclofenac has been available for years by prescription in pill form, but is recently approved over the counter as a topical gel. By applying it externally, it has less side effects than when it's taken internally as a pill. If you're thinking about trying an over-the-counter medication, it may be worthwhile to have an initial consultation with your doctor to make sure that your minor symptoms don't represent a serious condition and that over-the-counter treatment is appropriate. You should also see your doctor if the over-the-counter treatment is not effective. But you should not think that over-the-counter medications are weaker or less effective than prescription drugs, because as we saw today, many over-the-counter drugs required a prescription until just recently. Thanks for watching.